Climate change is more than just rising temperatures and melting ice caps. It's a global phenomenon that's reshaping the environment we live in, and as a result, it's having profound effects on our health. In this video, we'll explore the many ways environmental changes are impacting human well-being, from the air we breathe to the diseases we face. Let's begin by understanding the connection between our planet's climate and our own bodies, and why this topic matters to everyone everywhere. Climate change refers to long-term shifts in temperatures and weather patterns, mainly caused by human activities like burning fossil fuels. These changes are not just about warmer days, they include more extreme weather, shifting seasons, and unpredictable rainfall. All these factors combine to create new challenges for our environment and ultimately our health. Understanding what climate change is helps us see why its effects on health are so significant and far-reaching. As the climate warms, air quality often worsens. Higher temperatures can increase ground-level ozone and smog, making it harder for people, especially those with asthma or other respiratory conditions, to breathe. Wildfires, which are becoming more common due to drier conditions, also release harmful particles into the air. Poor air quality doesn't just cause coughing or discomfort, it can lead to serious health problems, including heart and lung diseases. Heat waves are becoming more frequent and intense as our planet warms. These extreme temperatures can be dangerous, especially for the elderly, children, and those with chronic illnesses. Heat exhaustion, dehydration, and heat stroke are just a few of the risks. In cities, the urban heat island effect makes things even worse, as concrete and asphalt trap heat. Protecting vulnerable groups during heat waves is now a growing public health challenge. Warmer temperatures and changing rainfall patterns are expanding the habitats of disease-carrying insects like mosquitoes and ticks. This means illnesses such as malaria, dengue, and Lyme disease are appearing in new regions. People who never had to worry about these diseases before are now at risk. Public health systems must adapt quickly to track and control these emerging threats. Floods and heavy rainfall, both linked to climate change, can contaminate drinking water with bacteria, viruses, and chemicals. This leads to more cases of waterborne illnesses like cholera and diarrhea, especially in areas with poor sanitation. Children and the elderly are particularly vulnerable. Ensuring safe water supplies is becoming even more critical as our climate changes. Climate change affects how and where our food is grown. Droughts, floods, and unpredictable weather can damage crops and reduce yields. This means less food is available and prices can rise, making it harder for families to afford healthy meals. Malnutrition and hunger become bigger risks, especially in poorer communities. Protecting food security is now a key part of public health planning. Stress and anxiety caused by extreme weather events, displacement, and uncertainty about the future can take a toll on mental health. People affected by floods, hurricanes, or wildfires may experience trauma, depression, or post-traumatic stress disorder. Communities need support systems to help people cope with these emotional challenges as climate change continues to disrupt lives. Not everyone is affected by climate change in the same way. Children, the elderly, people with chronic illnesses, and those living in poverty are often hit the hardest. They may have fewer resources to adapt or recover from environmental changes. Recognizing and supporting these vulnerable groups is essential for building resilient communities. Hurricanes, floods, wildfires, and droughts are becoming more frequent and severe. These disasters can cause injuries, deaths, and long-term health problems. They also disrupt healthcare services, making it harder for people to get the care they need. Preparing for and responding to extreme weather is now a major focus for health professionals. Longer growing seasons and higher carbon dioxide levels mean that plants like ragweed produce more pollen. This leads to longer and more intense allergy seasons, affecting millions of people. For those with asthma or other respiratory conditions, this can be especially challenging. Managing allergies is becoming a bigger part of public health as the climate changes. Climate change doesn't just affect how much food we grow, it can also impact the nutritional quality of crops. Higher levels of carbon dioxide can reduce the amount of protein, vitamins, and minerals in staple foods like wheat and rice. This means that even when food is available, it may not be as nutritious, increasing the risk of deficiencies. Rising sea levels, droughts, and other climate impacts are forcing people to leave their homes. This displacement can lead to overcrowded shelters, poor sanitation, and limited access to healthcare. Migrants and refugees often face higher risks of illness and injury, making it crucial to address their health needs during and after relocation. Extreme weather events and new disease outbreaks can overwhelm hospitals and clinics. Power outages, damaged buildings, and supply shortages make it harder for healthcare workers to provide care. Strengthening healthcare infrastructure is essential to ensure communities can respond to the growing health challenges of climate change. Workers in agriculture, construction, and outdoor jobs are exposed to higher risks as temperatures rise and weather becomes more unpredictable. Heat stress, dehydration, and injuries from extreme weather are growing concerns. Protecting workers with better safety measures and policies is now more important than ever. As sea levels rise, coastal communities face increased flooding, loss of homes, and contamination of drinking water. These changes can lead to injuries, waterborne diseases, and mental health challenges. Planning for sea level rise is essential to protect the health of those living near the coast. As more people move to cities, urban areas become hotter due to the heat island effect. Less green space and more concrete mean higher temperatures, which can worsen air quality and increase health risks. Urban planning that includes parks and trees can help cool cities and protect residents' health. Climate change is shifting where and when diseases occur. Illnesses once limited to certain regions are now appearing in new places. This makes it harder for doctors and public health officials to predict and control outbreaks. Staying alert and adapting to these changes is crucial for protecting public health. With changing weather patterns, some regions may face repeated crop failures leading to chronic food shortages. This can cause long-term malnutrition, especially in children, affecting growth and development. Addressing nutrition insecurity is vital for ensuring healthy futures for all. Changing temperatures and humidity can affect how viruses and bacteria spread through the air. This may increase the risk of airborne diseases, especially in crowded or poorly ventilated spaces. Improving air quality and ventilation is an important step in reducing these risks. Children are especially vulnerable to the health impacts of climate change. Their bodies are still developing and they rely on adults for protection and care. From increased asthma rates to malnutrition, the risks are serious. Ensuring a safe environment for children is a top priority as we address climate change. Older adults often have weaker immune systems and may struggle to adapt to extreme heat, poor air quality, or disasters. They are at higher risk for heatstroke, respiratory problems, and complications from chronic diseases. Community support and targeted health services are essential for protecting the elderly. Climate change can damage economies by disrupting agriculture, increasing healthcare costs, and reducing productivity. When families and communities have fewer resources, it becomes harder to access healthcare, nutritious food, and safe housing. Economic instability can worsen health outcomes, especially for those already struggling. Communities that work together to prepare for and respond to climate impacts are more resilient. This includes building stronger infrastructure, sharing resources, and supporting each other during disasters. Resilient communities can recover faster and protect the health of their members more effectively. Doctors, nurses, and public health officials are on the front lines of the climate and health crisis. They help treat illnesses, educate communities, and plan for emergencies. Supporting healthcare workers with training and resources is vital for an effective response to climate-related health challenges. Preventing the worst health impacts of climate change means both reducing greenhouse gas emissions and adapting to new realities. This includes cleaner energy, better urban planning, and improved healthcare systems. Everyone has a role to play in building a healthier, more sustainable future. Raising awareness about the health impacts of climate change is crucial. Education helps people understand risks and take action to protect themselves and their communities. Schools, media, and public campaigns all play a role in spreading important information. Governments and international organizations are key players in addressing climate change and its health impacts. Policies that reduce emissions, protect vulnerable groups, and invest in healthcare make a big difference. Global cooperation is essential for tackling this worldwide challenge. Individuals can make a difference by making sustainable choices like using public transport, reducing waste, and supporting clean energy. Small actions add up, and when communities work together, the impact is even greater. Everyone has a part to play in protecting health and the environment. The impact of climate change on health is complex and far-reaching, but it's not insurmountable. By understanding the risks and working together, we can build healthier, more resilient communities. Whether through policy, innovation, or everyday choices, we all have a role in shaping a safer, healthier future for ourselves and generations to come.